Welcome everyone to today's webinar, Price Transparency, Interworkings of Real-Time Benefit Check Solutions and the Impact of Intentional Prescribing. I am Ayla Ellison with Becker's Hospital Review. We will begin today's webinar with a presentation and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We are looking forward to hearing your questions. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. At this time, it is now my pleasure to start today's webinar by introducing our presenters. Jordan R. Hilscher is an EHR Solutions Engineer with CoverMyMeds Provider Organization. He works with EHR vendors to outline and define requirements and specifications for the CoverMyMeds solution suite. Since joining CoverMyMeds in 2014, Jordan has served multiple areas of the provider organization, including account management and business development, and he played a key role in launching the company's first EHR partnership. He received his Bachelor of Science from the University of Findlay, and he is a member of HIMSS, NCPDP, and HL7. As a provider solutions consultant, Brian Colligan supports the CoverMyMeds EHR and health system sales team by utilizing his extensive background in EHR implementation. He helps EHR vendors and health systems integrate with CoverMyMeds directly within their solutions. Before joining the organization in 2018, Brian spent 7 years with Bon Secours Mercy Health, leading both inpatient and ambulatory Epic teams, where he worked with clinical leadership to implement improvements to the provider experience within the Epic EHR. Brian received his Master of Healthcare Administration from Ohio University and is an active member of HIMSS, ACHE, and CHIME. He was recently named CoverMyMeds Sales Support Person of the Year. At this time, I am pleased to turn the floor over to Jordan to begin today's presentation.
Thanks, Ayla. I appreciate the introduction. Brian and I are very excited to be speaking with everyone today about real-time benefit check, and certainly appreciate everyone's time today. Wanted to cover a couple learning objectives, something that we hope that you guys take away from today's session. The first being how real-time benefit check compares to formulary and benefit data. The second being talking about the future of real-time benefit check, prior authorization avoidance and medication access. And lastly, how a real-time benefit check solution can help health systems boost medication adherence. So before we jump in, I thought it would be helpful to sort of level set with everyone and go through some industry terminology. Myself, participating in several healthcare webinars and conferences, I know that it can be a little overwhelming with all of the acronyms that are thrown out. So just wanted to cover a few that we'll be discussing today. RTBC is real-time benefit check, and that is pretty much the standard terminology when we discuss price transparency in real-time benefit solutions. RTPBC, real-time pharmacy benefit check, is essentially the same thing. It's just another flavor for how some decide to say real-time benefit. RXBC is Rx Benefit Clarity, and this is the CoverMyMeds real-time benefit check solution. FMB, Formulary and Benefits, this is the eligibility data that is returned in the 271 response that often houses the formulary information. EPA, Electronic Prior Authorization, and ePrescribing, Electronic Prescribing. I think those last two are pretty self-explanatory and something that mostly everyone here is familiar with. So diving into the current ePrescribing workflow, I wanted to discuss what's happening today and where that data is coming from. Currently, there are 3 options to get eligibility data. There's a static FMB file, there's a real-time call to get that static FMB information, and then there's a real-time benefit check. For the sake of this discussion, I wanted to focus on FMB. This data originates and is maintained at the PBM plan level, and it's delivered at an unknown time frame to an intermediary that ultimately houses it all. I think it's important to also note that each plan operates and delivers this information on their own timeline. By the time this information gets to the provider, it's not uncommon that this information is outdated. And this has direct impact on information such as formulary, cost, prior authorization requirements, and others. The other way to receive this data is by making a real-time API call to this static file. I think this is important to call out because in some discussions you have with providers or other stakeholders, they believe that they are utilizing a real-time benefit check solution, but in fact is only grabbing that static F&B data at a real time. Both of these methods can create many provider challenges that ultimately leads to distrust, abandonment, and a search for a better, more accurate solution. CoverMyMeds recently conducted a provider survey where it was reported that providers have an average trust rating of 5.7 out of 10. And the lack or inaccuracies of that formulary and benefit data has led to this extremely poor rating. We as an industry need to take actions to drastically improve this number and gain providers' trust. So we talked about challenges that providers are facing with some of the data that they're getting. Let's take a look into what's driving patient decisions and the challenges that they run into when it comes to medication access. We commonly see this broken down into 4 categories: affordability, quality, time, and convenience. As many of you know, affordability can really vary from patient to patient. Everyone has their own financial situation and definition for what is deemed affordable. In 2018, the average American family of 4 with insurance through their employer spent more than $12,000 between their premiums and out-of-pocket costs on their family's health care. This does not include employer contributions. In 2018, the median household income in the U.S. was roughly $61,000 a year. So looking at those 2 numbers, what that tells us is that the average American household in 2018 was spending roughly 20% of their annual income on health care. That's, to me, pretty eye-opening and a huge burden that this creates for families financially. For others, the decision-making lever is quality. Some patients are concerned with just receiving the latest and greatest treatment. These could be patients who pay more for branded medications even when there are generics available, or simply they just don't care to do any price shopping. Time is a big factor for driving decisions. If a patient is facing a debilitating diagnosis, their only concern is getting treatment ASAP so they can get back to their normal lives. As patients ourselves, I'm sure all of us have come to a time or crossroads where ultimately we just want to do whatever it takes to get the medication so we can start feeling better. And when patients encounter moments like this, their health decisions are dictated by how quickly they can get access to treatment. Lastly, when we think of patient choice and the general idea of consumerization of healthcare, convenience definitely comes into play. When patients have the power of choice, decisions are commonly made based off this. Going back to our 2018 family of 4, maybe they're willing to pay a little more for their medication at a pharmacy all the way across town. Life happens, work schedules, getting the kids to and from soccer practice, all of this is very time consuming, and some would justify that spending that extra money would be worth it for the time saved. In a survey CoverMyMeds conducted with patients in 2018, 87% of patients surveyed indicate it would be valuable to them if the provider could share the cost of the medication they intend to prescribe. Having that type of visibility brings affordability, quality, time, and convenience more upstream and the patient on a clear path to adherence. Looking at the patient population, 43% of adult patients are enrolled in high deductible health plans. In 2017, the average out-of-pocket cost for patients on these plans was $270, and compare that to $29 for those with co-payments. And looking ahead in the foreseeable years, with the increase in specialty medications, these cost decisions are only going to become more important and more complicated. But there's still more options available out there for patients. 10% of patients being uninsured and 23% of prescriptions that are cheaper paying cash. This gives patients flexibility in choosing their best path to therapy. But again, this information is lacking at the point of prescribing. So I wanted to take a moment here and walk through what could be a real-life example. Charisse, she's a 64-year-old mother of two who is on a high-deductible health plan through her husband's employer. They're middle class, they live on a fixed income, and Charisse has a family history of heart disease, but has been quite healthy over the years. 6 months ago, Charisse noticed she was feeling fatigued and experiencing shortness of breath. Then she noticed what felt to be heart palpitations. She decided to make an appointment with her doctor to see what was going on. After running tests, including blood work, Charisse was diagnosed with atrial fibrillation. Her blood work indicated that her INR level was dangerously low, making her high risk for blood clots and possibly a stroke. Because of this, her doctor prescribed a blood thinner. Charisse went to pick up her prescription, but at that time she discovered that a 30-day supply was going to cost $272. This was a cost that Charisse and her husband could not afford with their fixed budget. Instead, she vowed to eat healthy and exercise, and that ultimately she would feel better and be okay. 2 months after her diagnosis, she suffered a stroke caused by a blood clot that traveled to her brain. She spent 10 days in the hospital and another 3 weeks in inpatient rehab. So yes, this is a fictional story, but I'm sure that there are some listening today that have maybe a friend, a family member, or have personally experienced in a like scenario when ultimately trying to pick up their medications from the pharmacy. Scenarios like Charisse's can be avoided with a real-time benefit check. Leveraging technology that exists in pharmacies today and delivering it to the point of prescribing, that will really empower the patient and prescriber discussion and ultimately reduce prescription abandonment. From an industry standpoint, this is still relatively new technology and has only been available from some vendors between 18 to 24 months. Cover My Meds being one of those organizations, we've seen a huge impact this has on outcomes already, and my colleague Brian will go through some of those stats later on. So we've talked about formulary and benefit information and real-time benefit check separately, but let's stack them side by side and look at the key differences here. Specifically looking at formulary level, the PA identification accuracy, and the data that's displayed. All of these are major drivers. Real-time benefit check delivers patient-specific information and not group-level formulary like F&B does. Static files through F&B are near impossible to manage at the patient level, and this leads to several inaccuracies delivered. With a real-time benefit check solution, PA flags are near 100% as real-time calls are made to the patient's benefit processor. Today, many providers would actually rather get the notification from the pharmacy because this is their only way of knowing when a true PA is needed. With formulary and benefit data, there is uncertainty if PA is required, or if a flag is delivered that one is needed, chances are it's a false positive. And what I mean by that is when that flag comes back as true and the nurse or MA takes the time to prospectively submit that prior authorization either electronically or manually to the health plan, the plan would then respond with PA not required. This happens way too often and is an extremely frustrating process. Lastly, the availability of data is a big difference. A great example is pharmacy cash pricing. Think if there's a $5 generic program at your local pharmacy. That's something you as a patient might want to consider. Another being if there was to be a change in coverage. Because these files are updated inconsistently, you might not have the most up-to-date coverage info at the time of visit. Real-time benefit check solves all of these problems. And it's important to consider a solution that takes a balanced approach, delivering the most comprehensive and accurate data set. So at this time, I'm going to hand it over to my colleague, Brian, and he's going to walk through what this could look like within the provider setting or within your software, and also what are some of the key benefits or expectations you could see with real-time benefit check.
Thanks, Jordan. So again, just to give an idea of what a real-time benefit solution may look like within your EHR, we have a mock-up here. This may be different than what you're used to seeing, or it may be different than what the integration might look like within your EHR. Also to note, the medications we have here are fake, so don't worry what a Praritin does to save lives. It's a made-up medication. But essentially with the same patient, Sharice, we have a Praritin that we're going to order. And once we place that order, what we have is that real-time transaction that runs in the background. And essentially what that does is that gives us benefit information in regards to the patient's coverage, where the medication is going to go in regards to what pharmacy, and how much it may cost. So it also gives us some options as well. You can see we have the ability to stick with the same medication, stick with the Praritin. It's expensive. It's going to require a prior authorization. Or we have some therapeutic alternatives that we could switch to that are much cheaper. Those alternatives also aren't requiring a prior authorization. So getting options from a patient care perspective and helping reduce some of those barriers to help from a medication adherence perspective. So continuing along with the survey that Jordan spoke about, we also completed one on the provider side. And what we found too is that 86% of providers surveyed that if they had a reliable solution, it would benefit their patients and also assist them in making more informed decisions when it comes to treatment. So again, it's about being able to have a good real-time benefit solution that can provide the right tools to help patients get the medications they need to live healthy lives. And then also assist your clinical staff to decrease your administrative time. That way you can spend more time from a direct patient care perspective. What should you expect to see from a real-time benefit solution? And being able to put together a solution that works for you from a whole picture, from start to finish, having access to multiple data sets in order to provide the right information that works for your providers and your patients. And so some of these factors that you want to take into consideration when looking at benefit solutions are patient pay amount, thinking beyond just what a patient's copay may be or what would just work from a coverage perspective. Having access to cash price information or patient assistance programs is beneficial because sometimes it's actually cheaper to pay outside of your benefit. You know, almost a quarter of the time there's some sort of program, or even by paying cash, you can actually pay cheaper than what some of your benefit coverage would allow. And I'll give some real-world examples of that towards the end of my presentation. PA requirements. Is a prior auth required? So again, a real-time solution is going to run that real-time transaction to identify whether or not a prior auth is available. So if you can avoid a PA, and again, that's another one of the barriers you can remove from a medication adherence perspective, avoiding that altogether, it saves time from an administrative perspective and also helps the patient out. Formulary alternatives, again, being able to avoid a PA or an expensive medication, so helping those individuals get the medications based off of being able to change up medications on formulary alternatives versus maybe just guessing around within the same drug class. You'll actually have the patient-specific information. Deductible information is good to have as well. Some patients will never meet their deductible. It may not be pertinent to them, but you'll have other patients that will, some that actually even plan it out to figure out when they can meet it and how. So knowing that, one patient may want to meet the deductible and they know 3 or 4 of their refills of an expensive medication is going to get them there. So they'll be able to meet that throughout the time frame. Or if you have a patient maybe not as involved, but you see that they maybe only have, $20 or $30 left on their deductible or $100, you can help, explain the process to them and get them to there. And then last, the pharmacy of choice and what that pickup method would be. So whether it's delivery, retail, or even specialty, being able to have the option of the real-time transaction taking place of notifying where that pharmacy is. And so what you can do is essentially, pharmacies have different prices, right? So if you're going to pay cash, or maybe if you have a coupon code, 2 pharmacies that are right across the street from each other may actually have 2 different prices. They could be a $20 difference for that patient. So again, notifying them what's the cheapest, best route for a pickup method works. So these are just some factors that you should take into consideration when you're looking at a real-time benefit solution in order to make sure you can build a solution that helps from a start to finish and looks at the big picture rather than just a one-sided benefit solution. So what are some of the impacts that you would expect to see once you start using a real-time benefit solution? What can you expect to see from a clinical care perspective and efficiency perspective? First thing would be increased use of preferred formulary. Again, it's this real-time transaction that's taking place behind the scenes. It's not reliant on a formulary that's maybe updated once a week or maybe not even maintained that much. You essentially are getting that real-time information right away. A reduction in administrative work. So again, being able to avoid a prior auth altogether, not having to deal with the paperwork that comes along with that, the back and forth conversations with the patient and the pharmacy. So reducing that administrative work. Reducing the time to therapy. So again, if you're able to break down the barriers that prevent patients from picking up their medications, whether that's a cost is too high, they don't want to wait for a prior authorization to be complete, knowing whether or not a medication is even covered. So being able to know that ahead of time can help you reduce time to therapy. Along the same lines, you can reduce prescription abandonment. Instead of having a patient show up to the pharmacy and experience sticker shock, not knowing that the medication that it was just ordered is going to cost them $80 to $100, being able to either have that conversation that it's an expensive medication ahead of time, or being able to find an alternative that's much cheaper, or maybe some sort of cash assistance program that will help that patient to pick up that medication. And then last, increased time for direct patient care. So again, if we're able to reduce the administrative work behind the scenes, it'll free up time for your clinical support staff to be able to spend more time with direct patient care. So let's take a look at a couple use case scenarios. So I'll go through 4 examples here, 2 related to alternatives, 2 related to cash assistance programs, and kind of try to build a picture of what it looks like and why it's important to have a solution that can, kind of entail all of the information in regards to what happens when a patient orders or a provider orders a medication. So in a good case scenario for an alternative, we have Kim, who's a 41-year-old. She's on a low deductible plan, but she has chronic migraines. Kim's priority is just to get the least expensive treatment possible. That's all she cares about. That's what's important to her. She essentially is, her provider's going to prescribe her a medication. It's going to cost her $110 a month, and it also requires a prior authorization. But with a real-time benefit solution, she's actually presented alternatives that actually will present to the prescriber. She can change the medication with the therapeutic equivalent and only spend $10 a month, and she can avoid a prior auth altogether. So in this case, the alternative works great for Kim because she's paying less money, and they're also avoiding the prior auth. Now, in a scenario where it may not be, where you may need more information besides just having access to alternatives, you have Carl, who is a 34-year-old on a high deductible plan. typically doesn't have any chronic issues, but currently has an acute derm flare-up. So if you run a transaction through Carl's Benefit, it notifies there's no alternatives that are available, and it's going to cost $600 for a 90-day fill. Well, if you're only looking at one part of the picture here, then you wouldn't be able to see that there's actually a coupon program that would lower that cost to $50. And so being able to have access to multiple data sets to be able to pull that information forward helps you find the right scenario and the right information for each individual patient. Now, if we look at the patient assistance and cash program side of things, we have Kara, who's a 24-year-old on a high deductible plan, but she never meets her deductible, no chronic illness, and for her, just like Kim, she wants to pay the cheapest amount out of her pocket. So a prescription's ordered for her, and her prescriber is notified essentially that if she actually pays cash, it's only going to cost her $50 per fill rather than the $100 per fill of what would happen if she runs it through her benefit. So again, this would be a good example of where having access to multiple data sets would work. In this case, she's able to save money by knowing that it's actually cheaper for her to pay out of pocket. Now, on the other side of that, we have Robert, who is a 52-year-old diabetic. He's on a high deductible plan, but he meets his deductible every year, and he actually plans on that. So for Robert, having an expensive medication isn't the end of the world to him. It actually helps him meet his deductible because he does have chronic care that he needs to take care of. And so he wants to use his benefit. He wants to be able to pay into this benefit, meet his deductible. So in this case, if you're just looking at the patient assistance and cash programs, he's actually going to pay more out of pocket than what he would if he would meet his deductible. So where if he paid out of pocket, it would cost him $3,600, but if he ran it through his benefit, he would then meet his deductible at $3,000 a year, saving himself $600. So again, just trying to pull together a real life example of why it's important for us to to evaluate multiple aspects of it to get the full picture of what it's like from a real-time benefit solution. So I've been talking about what current state really is for real-time benefit solutions, but I think it's important to know kind of what the future state would be. And I think the future state is putting more of this information in the hands of the consumers, in the hands of the patients themselves. So as patients become more of a consumers, they become more involved in their healthcare. Being more involved helps them truly make the care team be truly patient-centric. And so by allowing them to have access to tools such as a real-time benefit solution, you have the ability to have them to be informed of what medications they're on, how much it may cost, and just having that idea of what a visit to the doctor is going to cost to them or what a visit to the pharmacy is going to cost to them. So by proactively being able to manage their own savings, the patients can use the same tools to make decisions ahead of time about how much it may cost to get that medication. And then allowing patients to make decisions about their fill method after the script has already been submitted. So often when you send a script to the pharmacy, patients may not be familiar that they could switch it, and have it sent to a different pharmacy. Often the patients will feel trapped that they don't really have a choice after it kind of went out the door to this pharmacy. Now I have to go there. But options like sending it to a virtual pharmacy that may be able to either let the patient look for information on their own to decide what pharmacy they want to send it to eventually, or even some sort of medication management where in that virtual pharmacy they're able to send it on and find that once they find the cheapest, best route for that patient. And then last, encouraging medication access. So putting these tools in the hands of the patient helps reduce the burden of patient callbacks, and it also encourages that medication access. So you have a provider that's educated on it, you have a patient that's educated on it, and they're able to find together the best options that they have. So there's not the prescriber looking around at pharmacies, price shopping, trying to see what they can do. The clinical support staff's not on hold with the patient's payer for minutes, hours, trying to find the right information of what's included on there. You have a patient that can come to you and say, I know this brand name is not covered, but I see that this alternative is. Maybe we should try this route first. So, all these tools are very nice to have, but of course, once you implement them, you want to be able to see results. You want to be able to obtain something that you can measure, and that's exactly what we were able to do here at Cover My Meds. So we completed a study with a leading EHR solution with over 120,000 prescribers over a 10-month time frame. And what we were able to see is that the real-time benefit solution was able to provide a patient pay amount that returned a 97% accuracy rate. So what that means is it's increasing your provider's confidence when they're speaking about the cost to their patients. Implementing a solution that your end users don't have faith in, or you don't want to have a provider tell someone a medication is going to cost $20 and then they show up at the pharmacy and it's going to actually cost them $80 or $120. So being able to provide accurate information, you certainly want to be able to do that, and we were able to do that. Probably what's most important is medication adherence, and what we saw is that when there was an RTBC transaction that took place, the patients were actually 19% more adherent to picking up their meds. So again, it goes to breaking down those barriers, having the ability to have the conversation with the patient. This is an expensive medication, but let's see if there's an alternative. And then being able to provide the cheaper alternative. This medication's not covered, so instead of me trying, you going to the pharmacy and then sitting at the pharmacy when they say they can't fill it, then the pharmacy calls the provider office, you've got a patient that's waiting at the pharmacy, and they're eventually just going to give up. They don't want to sit around at the pharmacy for 30 minutes while we try to figure out what they have. So any barrier that we can remove, whether it's cost or coverage, is success, and that's what we were able to see. And then also in the same amount, we were able to see that same-day pickup was available for 84% of those transactions. So in addition to that, 61% of the medications were actually available within 1 hour. So along the same lines of removing those barriers, if you know that it's covered or you have the ability to switch to a cheaper alternative, then you're able to break down the barriers and help increase medication adherence. Switching kind of going down a different route here to talk a little bit now about implementation in regards to what it may take to have a real-time benefit solution within your EHR, and maybe what the questions are that you should ask your clinical leadership team in regards to that. First would be to just check with your EHR to see if they have tools available. I think roughly 85% of all EHRs now have some form of real-time benefit solution. And what does it take to get that built out? Does it require an entire system upgrade? Is it an individual opt-in in regards to getting it to working for your clinic? So those are questions you should ask for some of your clinical IT staff. You also want to make sure that your solution has true real-time capabilities. So where Jordan had talked about the formulary and benefit file versus the real-time transaction, there's some solutions that actually have that still use a formulary and benefit file, and again, that doesn't get updated often, and the information's not accurate. So you want to make sure you're running that real-time transaction in order to get the best information possible for your prescribers. You also want to determine how that data is presented. So where does it show up within my workflow? Does it pop up in the middle of the screen? Does it show up in the bottom? Does it happen automatically? Can I manually run it? Those are questions that you want to ask. How is this going to fill into my workflow? Another thing to ask too is that can you determine that if the cost is less than $20, then don't present me with the information, or can we exclude specialty medications because we know they're going to be high dollar costs. So information like that is good to know. And then last, I think what's one of the most important things that we could do is you have to create a good training program, and it has to be consistent because you want to be able to scale that across all your providers. There's no point in implementing a solution if your end users can't understand it, if your end users don't know how to use it. Ordering a medication is one thing, but going to order a medication and then being presented with cost information, coverage information, being able to change an alternative can be very frustrating if you're not familiar with the process. So being able to create a robust training program at scale is very important. So this concludes our presentation for today. On behalf of Jordan, Cover My Meds, and myself, I want to take the time to thank you all for attending today's webinar. Hopefully you gained some value with the discussion today, and that you'll be excited about future real-time benefit solutions, and also that excited to implement them because they'll be beneficial to both your patients and your prescribers. So I'll now turn it over to Beckers to assist with the Q&A portion of the webinar.
Thank you, Jordan and Brian, for that fantastic presentation. We will now begin today's question and answer session. So please submit any questions you have by typing them into the Q&A box you see on your dashboard, and we will try to get through as many questions as we have time for. Throughout the presentation, we had several questions come in, so we'll go ahead and get started with those now. And the first question actually has to do with something that was mentioned on the last slide, and this person wants to know what is a typical implementation timeline?
Sure. I think you could easily obtain an implementation within a 6-week time frame. I think that's what we typically see. But it's certainly customizable to your organization. So if you want to go quicker, you can put the resources towards that. Or if you needed a little bit more time, that's fine. Obviously, a lot of the the clinical IT teams are stretched thin, and so finding out what works for them in between upgrades and go live for other things works. But a typical timeline, I would say, would be within a 6 to 8 week time frame.
Great, thank you so much. It looks like the next question that came in, it's a two-part question. So this person wants to know how many EHR clients do you currently work with, and then also how easy is the integration?
Sure. So from a Cover My Med standpoint, I know that we're integrated with 14 different EHRs. I think, as Brian mentioned earlier, looking holistically at the industry, there's about 85% of the EHR market that have access to a real-time benefit check solution. In terms of your second question, how easy is it? Different vendors sort of have different ways of integrating, so it definitely depends on who you're partnering with and how it's being done, the technology that's being used. But I think that for the most part, all real-time benefit check solution providers want to make it as easy as possible to adopt from an EHR standpoint.
Great, thank you so much for answering both parts of that question. The next question that we had come in, it has to do with the data feed. So this person wants to know, does the data feed from health plans include the pharmacy prescription insurance as well as the medical insurance?
So we strictly work off of that pharmacy benefit information, so it wouldn't include the medical insurance. All we need is the pharmacy benefit information to make that transaction take place, and so that's what we work off of.
Thank you so much for that clarification. The next question, this person is asking or wants to know when do you anticipate coupon and patient assistance functionality to be available through the RTBC solution?
Yeah, that's a good question. I know that there are a lot of solutions out there today that are already implementing that. So that's a discussion that you should have with your contact at your specific EHR to see if that is available and something that you could take advantage of today.
Great, thank you. And it looks like we have time for, we've had a few more questions come in, so we'll try to get through those as well. Let's see, this question, the person is referring to, it looks like an Epic, and so they're saying Epic has price transparency tool where prices appear after a visit summary, and do you know if the information is from RTBC or another source?
Yeah, so in that instance, what shows up on the AVS, the after visit summary, is exactly what takes place during that transaction. So if you order a medication with an Epic and it costs $40, what prints on the AVS is going to be the $40 from that transaction.
Great, thank you. It looks like we have time for a few more questions here. And this person is asking, how does RTBC get the correct primary coverage for each patient?
Yeah, so it looks at the eligibility information that comes back in that 271 eligibility response. So sort of to a point that we discussed today, some problems with RTB solutions are that with the inaccuracy of that data, it could be difficult sometimes to get a response because that data is incorrect. But there are solutions out there that have ways to sort of fix that and to look at historical claims in order to retrieve real-time benefit check responses. So it's looking at the data ultimately that's managed by that patient's health insurer.
Great, thank you very much. And it looks like the next question actually has to do with the case study that was mentioned during the presentation. And the person on this question just wants to know what the size of the case study was and how long did it run.
Yeah, so the case study actually ran over a 10-month time frame. It was with over 120,000 plus providers, and the study was conducted over 108 million transactions that took place through the AHR.
Great, and as a follow-up to that, what was used to determine that RxBC led to a 19% increase in medication adherence?
Yeah, so we can infer from claim data within that transaction that prescriptions showed a price or other value-added messages were 19% more likely to be picked up. So that's compared to the transactions within the program that did not see a response.
Great, thank you very much. It looks like we have time for one more question. And this person we sort of touched on this earlier, but just to clarify one more time, this person is asking, how do I know if my EHR has RTBC solution available?
Yeah, we would encourage that user to reach out to their IT department within the health system or an account manager at their particular EHR and ask, is there a real-time benefit check software available? And if so, encourage them to learn how to use it. If not, let them know that that's something that you are very interested in and would like to learn more on how you could get that going.
Great, thank you so much for the clarification. That is all the time that we have for today. Jordan, Brian, do you have any final thoughts you'd like to share before we conclude today's presentation?
No, just again, thank you very much, everyone, for your time. We know that everyone is extremely busy, but really appreciate you guys taking 45 minutes out of your day to learn a little more about real-time benefit check.
Agreed. Thank you, everyone, for your time. We really appreciate it.
Great. Thank you, Jordan and Brian, for your excellent presentation today, and CoverMyMeds for sponsoring today's webinar. Please enjoy the rest of your day, and we do look forward to having you join us for future webinars.